Welcome to Precision Anatomy. This channel is where we strip away the fluff to master the mechanics of the human machine. Whether you are here for clinical practice or to engineer better solutions for the body, you have come to the right place to build a foundation that is as deep as it is precise. Let's get to work.
Anatomy is not merely a collection of biological facts. It is the fundamental study of form and the physical relationships that define an organism. At its core, anatomy addresses the essential architecture of the body, what structures exist, where they are located, and how they are organized relative to one another. Without an understanding of this physical framework, biological function cannot be accurately interpreted. Historically, anatomical study has transitioned from simple observation and limited dissection to a sophisticated scientific discipline. Modern anatomy integrates this heritage with advanced imaging techniques, allowing for precise visualization of structures at multiple levels of detail. Yet, the objective remains constant: to accurately map the human architecture. This structural context is the foundation for all physiology, pathology, and clinical practice. Lacking it, any interpretation of disease or treatment is inherently incomplete. Beyond medicine, this knowledge is critical to biomedical engineering, informing the design of implants, prosthetics, and diagnostic tools to ensure engineered solutions interact safely and effectively with the body. True anatomical mastery requires moving beyond rote memorization to develop the spatial awareness and three-dimensional visualization necessary for advanced study.
To elevate this from a standard biological definition to one that reflects your biomedical engineering perspectives, we should emphasize its function as a structural system. Consider this refinement for your lecture. The skeletal system acts as the body's primary mechanical framework, a composite structure of bone, cartilage, joints, and ligaments. This system is engineered to provide structural support, shield vital internal components, and serve as the foundation for force transmission. Beyond its role as a structural chassis, it functions as a reservoir for mineral storage and the site of hematopoiesis, the production of essential blood cells. The skeleton is classified into two primary functional divisions, the axial skeleton and the appendicular skeleton. We categorize the system this way not merely for anatomical convenience, but to distinguish between the body's primary load-bearing chassis and the peripheral structures designed for force transmission and mobility. Axial. This serves as the central axis of the body, providing the structural core and protection for vital systems. Skull, the primary protective housing for the central nervous system. Vertebral column, the load-bearing column that facilitates structural support and spinal cord protection. Rib cage, composed of the ribs and sternum, forming the rigid thoracic enclosure for the cardiopulmonary systems. The appendicular skeleton. This division encompasses the extremities and the linkage points that connect them to the axial core. Upper limbs, engineered for reach, manipulation, and force application. Lower limbs, designed for weight-bearing, propulsion, and locomotion. Pectoral girdle, the linkage system connecting the upper limbs to the axial skeleton. Pelvic girdle, the robust interface connecting the lower limbs to the axial skeleton. Essential for stability and ground reaction force transfer. By separating the skeleton into these two functional zones, we gain a clear understanding of the mechanical distribution. The axial skeleton acts as the static, protective framework, while the appendicular skeleton acts as the dynamic, mobile interface with the environment. The human skeleton is defined by 5 critical engineering functions, each essential to the operational integrity of the biological machine. Structural support and load-bearing. The skeleton functions as the primary chassis of the body, establishing its geometric form and maintaining posture against external forces. It is the architectural framework upon which all soft tissues are anchored and organized. Strategic protection. The skeleton serves as a protective enclosure for the body's most critical components, designed to dissipate impact energy and prevent mechanical trauma to vital structures. Cranial vault, shields the central processing unit, brain. Vertebral column encases the primary signal transmission line, spinal cord. Thoracic cage protects the high-pressure cardiovascular and respiratory pumps heart and lungs. Kinetic lever systems. Motion is achieved through the interaction of bones, joints, and muscular actuators. Bones act as rigid levers, joints function as fulcrums, and muscles provide the tensile force necessary for mechanical displacement. This system converts chemical energy into kinetic output. Mineral homeostasis. Beyond its structural role, the skeleton functions as a dynamic reservoir. It stores and regulates essential minerals, principally calcium and phosphate, maintaining the systemic chemical balance necessary for cellular, signaling and tissue function. Hematopoiesis. Bone marrow acts as the body's primary manufacturing facility for the circulatory system, producing red blood cells, white blood cells, and platelets. This internal environment is vital for both oxygen transport and the maintenance of the body's defensive infrastructure. To operate with precision, we must establish a coordinate system. In engineering, we use axes. In anatomy, we use planes. These three geometric slices allow us to describe every movement and every structural relationship with zero ambiguity. One, the sagittal plane. This plane divides the body into left and right portions. Median mid-sagittal, an exact split into equal halves. Parasagittal, any offset split creating unequal portions. Mechanical context, this is the plane of forward and backward progression. If you are performing flexion or extension, you are operating within the sagittal plane. 2. The frontal plane coronal. This plane divides the body into anterior front and posterior back portions. Mechanical context, this governs lateral, side-to-side displacement. Movements, like abduction and adduction, moving a limb away from or toward the midline, exist here. 3. The transverse plane horizontal. This plane divides the body into superior upper and inferior lower portions. Mechanical context, this is the plane of torque. Any internal or external rotation of a segment occurs along this horizontal axis. To summarize it, let's strip away the complexity and view the body through these three slices. Sagittal, left or right forward motion. Frontal, front or back side motion. Transverse, top or bottom rotational motion. Establishing these planes is non-negotiable. Without them, you cannot accurately communicate the direction of force or the orientation of a structure. Use these as your primary reference points for everything that follows. To translate anatomical planes into physical action, we use a specific vocabulary of movement. These terms allow us to describe the dynamic displacement of the body's levers with engineering precision. Sagittal plane movements. These occur along the forward and backward axis. Flexion, a movement that decreases the central angle between two body segments. Extension, a movement that increases the angle, returning the joint to its neutral alignment. Hyperextension, extending a joint beyond its standard anatomical limit. Frontal plane movements. These describe side-to-side displacement relative to the midline. Abduction, moving a structure away from the body's midline. Adduction, moving a structure toward the body's midline. Transverse plane movements. These involve rotation around a vertical axis. Internal or medial rotation, rotating a limb toward the midline. External or lateral rotation, rotating a limb away from the midline. Circumduction, a complex, conical movement that combines flexion, extension, abduction, and adduction into a single circular motion. Specialized movements, forearm and hand. The forearm possesses a unique rotational capability. Supination, rotating the forearm so the palm faces anterior, which is forward or up. Pronation, rotating the forearm so the palm faces posterior, which is backward or down. Specialized movements. The foot. The ankle and foot operate on specific axes to manage terrain and locomotion. Dorsiflexion, moving the foot upward toward the shin. Plantarflexion, moving the foot downward, as if pressing a pedal. Inversion, turning the sole of the foot inward toward the midline. Eversion, turning the sole of the foot outward away from the midline. Scapula, jaw, and general positioning. For structural elements, like the shoulder blades and the mandible, we use linear displacement terms. Elevation, moving a structure superiorly, which is upward. Depression, moving a structure inferiorly, which is downward. Protraction, moving a structure anteriorly, which is forward. Retraction, moving a structure posteriorly, which is backward. Mastering these terms is essential. They are the coordinates of human performance. Whether you are analyzing a squat, a punch, or a surgical procedure, these are the only words that matter for describing the trajectory of motion. We conclude Chapter 1 by analyzing the morphology of the skeletal system. Bones are not shaped arbitrarily. Their geometry is a direct reflection of their mechanical function and the specific loads they must endure. 1. Long bones. These are defined by having a length greater than their width. Examples: the femur, humerus, and tibia. Mechanical roll. These act as the primary levers of the body. They are engineered to handle significant, bending moments and longitudinal load transmission during movement. 2. Short bones. These possess roughly equal dimensions in length, width, and thickness. Examples: the carpals of the wrist and the tarsals of the ankle. Mechanical roll. They provide high levels of stability and are designed to absorb and distribute compressive forces across a complex joint surface. 3. Flat bones. These are thin, flattened, and typically exhibit a slight curvature. Examples: the skull bones, ribs, sternum, and scapula. Mechanical roll. Their primary purpose is protection of internal systems. Additionally, they provide a large surface area for the attachment of broad muscle groups. 4. Irregular bones. These have complex geometries that do not fit into the standard categories. Examples: the vertebrae and certain facial bones. Mechanical roll. They fulfill specialized roles, providing a unique combination of protection, structural support, and specific attachment points for ligaments and tendons. 5. Sesamoid bones. These are small, rounded bones embedded directly within tendons. Example: the patella or kneecap. Mechanical roll. Their function is purely focused on efficiency. They reduce friction and increase the mechanical advantage of a muscle by altering the angle of the tendon, much like a pulley system. If we summarize it shortly: long, leverage and displacement. Short, stability and force absorption. Flat, protection and anchoring. Irregular, complex structural support. Sesamoid, mechanical efficiency. This completes the first chapter of our curriculum. You now have the full architectural map and the vocabulary of motion required to analyze the human frame. Build on this foundation, and I will see you in